panel is Professor Farida Khan. She is from College of Medicine, Hayel University. She is going to talk about impact of COVID-19 pandemic on medical education. And we can, I think, start her pre-recorded video.
Hello, Assalamu alaikum, warahmatullahi wabarakatuh. World Health Organization has declared COVID-19 pandemic on March 2020. Since then, there is a sense of panic and fear all around the globe. Several international and national studies have shown the impact of COVID-19 pandemic is not only on the physical, social, mental health, but it has profoundly affected teaching systems globally. Every educational institute, right from primary school to university, has adjusted their way of delivering education. Regarding medical education, every aspect of it is grossly affected, right from curriculum designing till training of medical students in clinic. During this paradigm shift, because of the pandemic, medical educators and students both have faced several innumerable challenges. Previous literature of the last few years has revealed that several factors influence positively and negatively on medical education.
This cross-sectional study was conducted in the College of Medicine, University of Hayel from November 2020 till February 2021. Our study respondents were both male and female MBBS students who were attending online sessions since March 2020. A structured questionnaire was constructed consisting of both supportive and inhibitory factors that they faced during the COVID-19 pandemic. After getting ethical approval from the Institutional Review Board of the University of Hayel, this questionnaire was fed on Google. Pilot testing was done on 20 medical students in order to test its validity and accuracy. Our sample size was 255 students. Data was fed on SPSS statistical package for descriptive and inferential statistics. Names and identity of the respondents were kept confidential.
As you can appreciate over here, in the pie chart on the left side, that most of our respondents were male students. The graph on the right side, it shows the percentage of response from medical students of different years of graduation. Maximum response was from 4th year medical graduates.
This slide is showing the different advantages or the positive impact of online academic sessions during COVID-19 pandemic. As you can see over here, the students, they have answered that they learned digital technology very effectively. Online learning has increased their confidence and self-efficacy, and it has motivated 61% of the students. Online session has increased their awareness of mega-cognitive skills or learning. And they found the online webinars very useful because they got the recording of it. Flipped learning that was adopted during that period, and still we are practicing it, it helps them to become lifelong learners. And they were very happy because there was flexibility of location and time when they attended the online sessions. And it's very cost effective. Because the students, they were of the opinion that those students who could not attend the college on regular basis because of sickness or maternity leaves or due to any other cause, they didn't miss their classes. Different disadvantages which medical students have experienced while having online academic sessions during this pandemic era are mentioned or are shown over here. Distance learning depends on internet connectivity and availability. So there should be no disruption in connectivity, use of cellular data or Wi-Fi as being rightly set by 95% of the students. Teachers' role as role model through online sessions is not possible, and it is being and they are justified because all the literature favors this point. 70% of the respondents revealed that online learning is not suitable to learn soft skills like community and patient's care. Almost half of the students answered that they hesitate to ask questions in online sessions and communication skills could not be developed effectively and efficiently. And the same proportion of the students replied that problem-based learning sessions were not delivered effectively as it was before when it was taken by physical presence. Lastly, it is shown that 78% of the respondents answered that online learning needs strong self-motivation. In this table, you can see there's a cross-tabulation of the variables that have positive impact on the academic sessions with the students' motivation. Here you can see that the confidence and the self-efficacy has a significant association with the motivation of the medical students. The medical students' megacognitive skills were highly increased, and they found webinars very useful. Last but not the least, flipped learning was found very helpful, where the students, they work and research on the topic before online lecture, so it helps them in self-regulation and they develop motivation which activate higher order thinking process. In this table, you can see that those variables which the students have highlighted in the previous tables that have negative impact on their academic sessions, those were cross-tabulated with the motivational level of the medical students. Here, the communication skills and the patient care skills, they could not be learned by online sessions, and the students, they were being totally demotivated. PBL sessions could not be done effectively, and that is a source of demotivation for the medical students. And similarly, students-teacher interaction could not be done effectively and efficiently, so it also demotivates the medical students. Medical education is now towards a student-centered approach, integrating with competency-based education, self-directed learning, team-based approaches, and personalized learning. The need for social distancing has significantly reshaped and innovated medical curricula by implementing virtual learning platform. COVID-19 pandemic has triggered introduction and implementation of new methods of teaching and learning all over the world. Two new formats are introduced: asynchronous and synchronous formats. Asynchronous format include recorded videos, podcast, while synchronous live online education includes video conferences and virtual classrooms. One of the new models is flipped classroom, which is a blended type of learning models that has synchronous component as flexibility for medical students in terms of time, place, and cost, and it has a synchronous component that is the interaction between the medical students and faculty members. In recent years, this online learning method has been widely used for educational purposes. A meta-analysis shows that a higher overall satisfaction rate with p-value less than 0.001 for online teaching and learning sessions with traditional education, reflecting that online teaching and learning was quite acceptable by medical students. Online learning has several benefits, such as flexibility in time, location, and it's cost effective. In order to adopt this new change, it is recommended that there should be frequent reflections, feedback, and evaluations in order to ensure successful educational environment for medical students. One of the major challenge that medical educationists face during this pandemic era is to conduct a valid and transparent assessment or examination. In many countries, written and clinical exams have been cancelled or postponed or delayed or have been replaced by a new method of assessment. 4 colleges in UK adjusted OSCE by using simulated patients than real patients. There is a hot debate between open book examinations and closed book examinations as well. In Imperial College London, online
Control.
assessment
How much time
consists
remaining?
of an open book exam of 150 questions. However, they random the order of the questions in order to prevent cheating. Multiple studies done
Okay, I think
during
we
the
can
last
conclude.
2 years have shown
can
that
conclude,
open
yes.
book